So I'm sharing my screen with you all. Okay. So is my slide visible to you all? Is it visible to everyone?
Yes, it is visible.
Okay. So good evening and welcome to another session for the Geriatric Rehabilitation Specialist. And today we'll have a talk on patient education and self-management in elderly patients or elderly population. See, being a physio or being into the healthcare management, we have to understand that it's our moral duty not only to treat the patient but to educate them also. And this education is actually not limited to the patients but also to the next of the kin or to the family members, the children's or the caretakers. We need to make sure them they understand about the patient's condition, they understands about the do's and the don'ts and what can be done to make the lifestyle or the management of the patient in an easy way. And by educating the patients, actually what we are doing, we are making them more and more independent into their functionality, which will give them a different level of confidence and that what do you say, like feeling of goodness when they do something which is like beneficial for them and they don't have to be dependent on to the others. So this is a very important aspect when you deal with a geriatric patient or in that case any patients. Okay, you have to make sure that they understand their problems and you educate them well about the management also. Okay. So, coming to the health education for the elderly, it is the process of enabling the elderly to increase the control and improve their health by developing their resources to maintain or enhance their well-being. And a self-care is the action of using the health, action for health using the knowledge, communication, and understanding. So, education is the process in by which you enable the elderly to increase the control and improve their health by developing the resources which are actually required for their functionality. So, if we train them, if we educate them, we can tell them, okay, you might be facing all these problems or you are facing all these problems, and you can manage all of these things by getting all these resources or by doing these simple steps. It will be much easier for you to manage your life or do your household chores. So what you are doing, you are actually educating them, and by educating you are providing them a way out to do all their works just by developing the resources and maintaining and or enhancing their well-being. Okay, now coming to the self-care. Now, because of this education, because of this knowledge, because of what you had, the communication with the patient, and because of this understanding what the patient understood from your point of view, what happens? A self-care is generated. The patient is becoming self-independent or is more pronounced or more attentive towards the self-care, and they take care of themselves when they have that urge to get better, because they have that understanding. Yes, whatever the condition I am in right now, it can be managed easily by myself, and whatever my therapist has said, I can follow it very easily. Is that clear? Is this clear to everyone?
Yes, sir.
Now, health promotion involves making lifestyle and behavioral changes in order to move towards the optimal health. The effort includes increasing the awareness of the health issues, promoting healthier behavior, creating supportive environment, developing preventive strategies, and encouraging the early detection and treatment. Okay, so what we need to do is to make the lifestyle and behavioral changes in order to make, or in order to do the optimum for the healthcare. And how we can do it? We can do it by promoting the awareness for the healthcare issues, what all problems an elderly person can have, promoting healthier behavior, promoting healthier lifestyle, supporting the current environment in which the patient or the subject is dwelling, coming up with the preventive strategies, because when we know in what kind of environment or the situation the patient is dwelling right now, we can actually go for the preventive strategies. And as we say that prevention is better than cure, so we can always prevent the problems earlier, and we can make sure that they don't occur, so that we don't have to manage them in the later time. And encouraging the early detection and the treatment, we should always and always go for the multiple checkups, or a repetitive yearly or semi-annual checkups or 6 monthly checkup, so that we can easily detect the conditions and we can manage them accordingly. Okay. So what are the objectives? The objective is to increase the quality and the years of healthy life. When we started with this course, we said that we need to add years to the life, not life to, sorry, we need to add life to the years, not years to the life. Okay. So we need to increase the quality. If we are only increasing the years and the patient is bedridden and the quality of life is not good, it is not good that we increase the years. Okay. The patient will be in similar kind of pain and will be more depressed, and maybe the condition will worsen over the period of time. You have to put in more efforts. But if we increase the life to the years, or we increase the quality of life, so what we will be doing, we will be actually making the patient very, very happy, and the patient will be much more satisfied with you as compared to the previous condition. Coming to the maintenance of function, eliminating health disparities and promote independency, which is very important. We need to eliminate any kind of health disparities and promote the independency. Everyone wants to be independent. A person starting from the childhood to elderly, they want to be independent. They don't want to be dependent on anyone. For example, if I'll see a patient, a pediatric patient, okay, if we'll see a child, for example, I'll say a newborn baby is actually dependent on the parents for feeding. But a child, when he or she attains the age of 4, 5, 6 months, they try to become more and more independent by holding on to the bottle. They try to hold on to the bottle. They try to latch onto the feeding mechanism, so that they become more independent onto that. They don't try to be dependent on the onto the feeding mechanism. They try always to latch onto the mechanism, to hold it by themselves, so that they can have that independence. Moreover, it is actually imbibed into your system, that if you see from the childhood, when the motor development starts to take place, a child is always programmed in such a way. If you see the movements, the gross movements are programmed in such a way that everything for them is food, and the movements are actually programmed in that way that if they'll catch hold of anything, they will take it to the mouth. Okay. So what is this thing happening? Because this is a trial and error method which is happening because of the genetics and the evolution. For them, everything is food. They want to taste everything. They want to eat everything. Why? To become independent. Okay. So this is one aspect. The second aspect is for the sensory aspects. When we talk about the pedia patients, then sometimes maybe I'll tell you why they usually take everything into their mouth cavity. One of the reason is because of the high sensitivity which is present there. So it gives them a different kind of sensation. So that's a different topic. But if you'll see the whole crux of this, a child, when he or she is born, till the elderly age or the senile age, everyone is trying to become independent as soon as possible and remain independent in that fact. Okay. Then the next is to improve or enhance the quality of life. Everyone is working to improve or enhance their quality of life. What they are living in right now, they are trying to improve it. And if they are not, then they will face the consequences in the later years. Okay. Extended life of expectancy, decreased premature mortality caused by chronic and acute diseases. So what are our objectives from this? We need to extend the life expectancy and decrease any premature mortality to the patients. I hope this is clear to everyone. The objectives for health education. Is this clear?
Yes, sir.
So components for health education will be your exercise, nutrition, rest, periodic medical checkups, high risk behaviors, spiritual well-being, psychosocial well-being, safety measures, and stress management. These are the components of health education. So coming to the first part, which is the exercise. So there are three major benefits for the exercises. Okay, we had a word about functional training and mobility and the importance of mobility in the patients yesterday. So similarly, we have some benefits which is associated with exercising, and the benefits are actually psychological, physical, and social benefits. So we'll discuss them one by one. With the physical benefit, the one of the major benefit that we get from exercise is consumption of the body fat. The amount of body fat that is stored in the body will start reducing if you'll start working out or if you'll start exercising regularly. There'll be an improved cardiovascular capacity by increasing the blood flow, and it will keep the tissues healthy. It will control the hypertension and blood sugar, improve respiratory function, improve joint flexibility, improve pattern of sleep and rest, increased independency, improve sense of well-being and relaxation, maintain mind's function, promote sense of normality and peristaltic movements. Okay, so everything which are listed here is actually a benefit of the exercises if a patient is doing it on a regular basis. We all know that when yesterday when we were talking about the exercising, I told you that the exercising is a complete package which includes aerobic, your strength training or the resistance training, your balance training, and flexibility. So everything here you can see is actually taken care of in that particular package. Okay, the joint flexibilities are there, the respiratory functions is taken care by the aerobic activities, your body fat is actually reduced by your aerobic and the resistance activities, your independency, your sense of well-being, relaxation, mind functions is actually taken care by your balance and coordination training. All these things are actually helping you out in carrying out the your life in a most channeled manner. And one of the best things that happens because of this exercising is the peristaltic movement. Now the movements which is actually happening into your gastrointestinal system is actually regulated very well when the person starts to work out, and the patient will not be having any problems which is associated with the genitourinary or the gastrointestinal system because of a better peristaltic movements. Okay, is this clear? Coming to the psychological benefits of the exercise, improve mood state, improve self-image, reduce stress and anxiety, enhance sleep, improve depressive state of elderlies, improve cognitive function, helps with memory and concentration, and improve mood. I wrote it again. So in when we talk about psychological benefits, we are getting multiple things which is happening into the background. When we are actually exercising, we are releasing serotonin and dopamine, which is actually serotonin and dopamine and other neurotransmitters and other happy hormones, which are actually required for the sense of well-being into the body. When you work out, when you sweat it out, you always take out the stress. Okay. Just a very good example, which I have seen in many of the MNCs nowadays, or from like I have seen this since I started my career. So I guess somewhere around I'm seeing this thing since 2000 12 or 13. It's been around 10 to 12 years that I've seen MNCs incorporating gyms and special areas in which the people can actually take out their stress. They have recreational areas, they call it recreational areas. And these recreational areas do have games, and apart from them, they have certain techniques or certain things which are available to take out your stress in the most like I can say absurd manner. Because one of the offices which I was working had a punching bag, and we had our punching gloves and everything. And if you are more stressed, I've seen people to go there and uh, do some punching training, and for 10-15 minutes, or even for 5 minutes, and they come out to relax after taking out all of their stress onto that punching bag. So and they also had gyms and all. So sometimes what people did was they usually go to the gym and do the workout, and they were refreshed when they came back to the stations. So when you actually apply that to a normal person, you are getting so much better results. When you apply it to an elderly, you will get much better results, because in the elderlies it is actually not so much stressful because they are not going to work now. So a small amount of exercise also will give you a bigger uh, change. Okay. As I told you, or I showed you yesterday also, when I showed you the video for improved cognitive function. So in functional training, we discussed that when we subject the patient to a dual task gait training, they will hamper their cognitive functioning. Okay. So by training them in this way, we can improve their cognitive functioning, and we can improve their lifestyle. Is this clear to everyone?
Yes.
Coming to the social benefits. Now, one of the best thing that you can do is to ask the patient to go for a group class, because it improves the social interaction and the relation with the others, improves social function. Man is a social animal, so we have to improve the social function, increases independence, increases social network and involvement, enables a person to participate and enjoy more of the social activities and enjoy more of the life. Okay. So, just an example, if I say it again, when a patient comes to my clinic, or I get a call uh, for consultation, sometimes what I have seen people, they want their services to be delivered at home. We are physios, and we are very familiar with the concept of home-based physiotherapy. I guess everyone is familiar with the concept now.
Yes,
Everyone.
sir.
Yeah. So you might be going to the visits, or you are sending someone. So we do have this facility to give treatment or the therapy to the patients at their home. But when in my clinic, when a person comes for a consultation, or when I get a call from the patient for consultation and for getting a home visit, I generally ask them about their present health condition. Okay. Whether they are able to walk or not, whether they are able or independent to come to the clinic or not. And I prefer them, or I say them, it's better that you come to the clinic, or even when I go to home for the consultation, and if I'll see that the patient is fine enough and he or she can come to the clinic for the treatment, I try to make them come to the clinic as much as possible, because of one reason of socialization. Okay. we have no problems. We can treat the patient at home, but the patient will be confined to these four walls only. Okay, but if the patient will come to the clinic, he or she will meet a few more people, they will have a chit chat, and they will see others getting better, and they will get that positive motivation from the other people that, okay, I was in this condition, now I am in this condition, and I have been benefited with this thing. So it's easier for you to get out from all this. And sometimes some bonds or some old friends actually meet up in the clinic, and it's like a union for them, reunion for them, and then it becomes a habit for them. So it's like a social gathering for them. They always look forward for that particular time, then when the clock will strike that time, and they will go to the clinic. Okay, so it gives them a purpose in the day. When they are retired, they have this purpose to go to the clinic, because they will go there and socialize with other people. They will talk to their friends. They will feel much better. They will have a walk. Okay. So this is a benefit of exercising, and being a physio, if you can work on it, and you can take the patients onto your clinic and ask them to come to their clinic much more often, it will be a blessing for them as well as you. I hope this is clear to everyone.
Yes, sir. Clear.
Coming to the role of physiotherapist during the exercises. So we as physios, what we need to do is we need to assess the patient before the beginning of the exercise program. We need to check their history and physical examination, check for their cardiovascular health, respiratory health, musculoskeletal and neurological system, check for their renal and liver function test if they have it with them. Please do check for the renal and liver function testing, because sometimes the patient might not have that idea that the patient is having some kind of renal or liver issues. And when they start to work out, it actually starts to give upon the stress onto the renal organs and the liver organ. Okay, so we need to make sure that there is no foul play happening in that particular region. And if it is there, we are managing it properly in the earlier stage only. We need to check for the ECG and exercise stress testing, assess for the range of motion and use for the assistive devices. We need to check for the range of motion, because what happens, I have seen people, they get over enthusiastic, over excited sometimes. And when there is a reduced range of motion, they will again try to get more out of it. And sometimes then because of this thing, they end up injuring their system. Okay. And assessing the range of motion is again, why is it important? It is important for the documentation. See, sometimes what happens when you assess a patient and you get a reduced range of motion in one limb, and the other limb is having a normal range of motion, then you can actually work upon the range of motion of the other limb for bringing it to the normal range of motion. But if the range of motion in your one limb is actually equal to the range of motion in the other limb, and you are seeing that it is not complete as a normal individual, if the patient is not able to extend the elbow till 180 degrees, and the extension is only till 160 or 170 degrees, and it is present bilaterally, then that is the normality value for that particular patient. So we should not push that patient for last 10 degrees, because it is normal for them. So we need to make sure, and we need to make the patient understand, see, this is your normality value. The limbs are actually at the same level. So you need not to push further. You might end up injuring yourself. And if someone says that your range of motion is not complete, you can always tell them, yes, see, my both the limbs are at similar range of motions. This is my normal range of motion only. Okay. And you need to assess the environmental hazards. Being a physio, you need to assess the environmental hazards, the region in which the patient is actually dwelling, the region in which the patient is actually working out. So what are the environmental hazards that a patient can be subjected to, and the results which can happen because of these hazards, and what are the measures that you can actually take to cut them down. One of the most important thing that a physio should do or a physio should promote is to set a regular time to exercise each day. Being a physio, we always say to our patient, please be on time for the exercise. We always try to go with the appointment based system. Now, why this? Because our body is very particular about things. Our body is very particular about sleep, very particular about food, very particular about other bodily routines. Okay. If anything happens or anything hampers from that, the body becomes restless. Okay. Whenever you are getting hungry, you have that window in which you will get hungry. Okay. If you are taking dinner at 10 p.m. every night and then taking the breakfast at 8 a.m. every day, so you will get hungry no matter what is the situation at 8 a.m. Before that, you won't feel that hungry. But as soon as the clock will strike 8, your biological clock will strike 8 o'clock, you will start feeling hungry. So the body always prefers a regularity in the functionalities. Okay. So it's better you always regularize the exercise pattern or the exercise timing also to reap the maximum out of the exercises. Is that clear?
Yes, sir.
Yeah, clear, sir.
Okay. So before starting the exercises, you should advise the elderly about to document the baseline resting functions such as heart rate, respiratory rate, and blood sugar. The patient should always start with a 10 minutes warm up and stretching exercises. Drink water before and after exercise is important, as well as water will be lost during the exercise. So the patient should remain hydrated. The clothes worn should in the exercise should allow for the easy movement and perspiration. The patient should not wear very tight or very loose clothes because they can lead to an injury. Athletic shoes provide both support and protection, where outdoor exercises should be avoided in extremely hot or cold weather. Okay, so all these things are basics which a patient or which a subject needs to understand before starting any kind of exercise. One of the most important things which a person should take care is of the footwear what they are uh, wearing to the exercise area or to the gym. Okay. See, multiple gyms or multiple sports facilities which are present in these cities. As you are all from multiple cities, I don't know whether other kinds of like what kind of facilities are there, but what kind of facilities I've seen in multiple cities are they are very strict about their policies. So they are very strict about their clothing policies. You cannot wear a pajama or like what you cannot wear a night suit and go to the gym or go to the sports facility and start doing the exercises. You cannot go to the exercise area in a chappals or in by barefoot or in sandals, right? You cannot go to these particular areas without having proper footwear. Why they do not allow? Because it will actually cause more of injuries rather than providing support to your feet. So having that athletic shoes or a proper footwear which supports your foot and protects it also uh, is very important. Okay, and outdoor exercises should be avoided if the patient is doing any kind of exercises in the community parks or the community gym, and it is the gym is present in open, and if it's like nowadays if it's raining heavily, so we should not ask the patient to go out and do the exercises because the environment will be slippery and the chances of fall will again increase. Similarly, if the patient is going for a workout in the outdoor gym in the chilly winters, we should ask them, okay, no issues. You sit down at home, do some of the exercises at home only with therabands or any other things that you have. Please don't go out because it might not be helpful or might not be beneficial for your health. You may catch hypothermia and the things may deteriorate. Is that clear?
Yes,
Is-
clear, sir.
Yeah. So nowadays that we have in metropolitans and in other cities also, we have multiple amounts of malls which are actually coming up. So I was watching this movie the other day, and there was this thing. The actor actually says to the other actor that I have come for a walk. Then this question comes onto them that you came for a walk in the mall. So he gives this answer that yes, everyone knows that Mumbai has more malls than parks, and you have a lot of area or a lot of room for walking in the malls as compared to the parks. So um, from that, we can say that enclosed shopping malls are a sheltered place for walking during the extreme weather or when there is a concern about the neighborhood safety. So, if a patient wants to go for a walk and it's raining heavily and the conditions are not good, or it is actually late at night or something like that, the patient or the subject can easily go for a walk in the mall. They don't have to do anything, they just have to climb stairs and go for a round in on one floor, then climb stairs, go for a round on the other floor, then come downstairs, go for a round on the ground floor, and then go back home. So actually that will be a fun recreational activity. They'll go out, they'll do some window shopping. It will be an exercise for them also, and they'll be happy and they'll come back home. Okay, exercising with a partner provides both encouragement to continue the exercise and safety. Working out with a partner, I'm not saying that you work out with a female partner only if you are a male, and with a male partner if you are a female. Anyone, if you have one of your best friend, you can be a male or a female, and you both go to the gym and work out. It's like nothing can beat that when compared to a single person working out alone, because at that time you lose track of the time, and once you lose track of the time, you tend to work out more, and you tend to work out in a better condition, and by keeping all the safety measures in the mind. Okay, and you should always advise the older adult to stop exercising and help if they experience the chest pain or tightness, shortness of breath, dizziness or palpitation during the exercises. Okay, so we need to make sure that uh, we advise our patients always that when they are working out and if they are getting any kind of symptoms like this for chest pain or tightness or shortness of breath or dizziness or palpitation during the exercise, they should immediately stop exercising and ask for help from the surrounding people so that they can Okay, is that clear?
Clear, sir.
Okay. Now, during the exercise, what the patient need to know or what he or she needs to understand is to monitor the heart rate and the respiratory rate. Everyone nowadays have their smart watches or smart wears wearables onto their hands and in their phones. So please monitor your heart rate and respiratory rate. Ask the patient to monitor it from their smart wearables. Stop exercises if the elderly has fatigue, chest pain, or increased heart rate or respiratory rate. After the exercise, 10 minutes cooling up at the end of exercise. Monitor the pulse rate during the cooling and returning to resting heart rate. Okay. So during the exercise, always need to monitor the heart rate and the respiratory rate. And if the patient has any kind of symptoms which are not good, then the exercises should stop immediately. And if the patient is normal, after the exercise, always ask the patient to go for a cool down period of 10 minutes to make sure that the muscles are relaxed and the joints are now not under any kind of stress, and the heart rate goes back to the resting heart. Clear?
Yes.
Coming to the nutrition, it is neglected, especially those living alone or with the lower income. Okay, nutrition is one part which is actually not taken care by anyone, not only the adults. the elderly, but also the young adults. We usually don't care about the nutritional part. There are only some of people who are very particular about their dietary habits, especially in India. It's not the thing that you usually go for, unless until you are actually told by a doctor, or you are required to do this for some special reason. Okay, so the factors which affect the nutritional status are the age related changes, the psychosocial factors, the economic factors, and the cultural factors. Okay, so all these functions are actually, all these problems are actually arising in the elderly because of these factors which are altering the eating habits of the subject. So age related changes, in which you can see there is a reduction in the sense of taste and smell. Usually when we eat food, so we get to know about the type of food what is coming to us first by the smell, and then we increase the appetite by the tasting. Okay, and what happens if you have a decreased sense of smell or decreased taste? Then you won't be having that urge to eat that food, because you don't know how that food is actually tasting, whether it is tasting good or bad. Okay, so a elderly is actually like a child. So if you see a child, they usually eat those things, or they usually turn up for those things which are actually um, tasting good for them, or they like that thing. So if the taste and the smell functionality is reduced in a elderly person, they are like a child. They won't eat it. They'll always refuse for it. Okay, because they are not liking it, whether it is healthy for them or not. Then there is something which is the visual acuity. The vision is actually very important in the part of sorry in the part of nutrition. As you have everyone seen in the recent years, all these cooking shows which are coming up, and the things which are there, and if you have gone to some fancy restaurants, what they are actually doing is they are trying to present the food in such a manner that the food looks tempting just by looking at it. Okay, so just by looking at it, if the food looks tasty, then the person will develop an appetite to eat it. But if the patient is not able to see it properly, and the patient is having a decreased visual acuity, then the patient will not be having that urge to eat food. In fact, it will happen with you also. You are preparing a meal at your home, and sometimes the food that gets prepared, it might be tasty, but it does not look that good. So what will happen at that time? You won't feel like eating that. Okay, like you have prepared porridge, or you have prepared khichdi or something like that, and somehow it got burnt, or somehow it got more watery, and it does not look normal, or the color is not that great. So you won't develop that appetite. What is your appetite naturally? Okay, it's a normal procedure. Loss of teeth and poor fitting dentures is one of the most common factor, which because of which the patient is actually reduced for the intake, because they are not able to chew the food in a better way. They are mostly dependent on to the liquid diet, so they won't be having that much of a nutritional uh, approach that is happening to them. And this is because of the age related changes which is happening into their um, uh, teeth and the dentures. Decreased gastric secretions which influence the absorption of B2, vitamin B12, folic acid, and iron. Okay, so the patients will have a decreased absorption of vitamin B12 and folic acid and iron, which will in turn have an impact on their overall health and will cause problems in their nutritional status. The food will remain longer in the stomach, and with decreased gastric secretion, it will lead to indigestion and feeling of fullness. So you must have seen that in the patients, elderly patients, that they usually don't feel that much hungry every time, or they don't go for a three course or three times meal or a four times meal in a day, as compared to a younger individual. Why? Because One reason is the food is actually remaining longer in the stomach. The metabolism is not that great, and the gastric secretions are already low, because of which the food is actually indigested and it is still there in the stomach and the intestinal region, and the patient will be having a sense of satiety because of this thing, and the urge of that hunger will not be. I hope this is clear. Age related changes.
Yes, sir. Clear. But we can do one thing, is, sir. Actually, I'm a clinical nutritionist. But as a diet and nutritionist, I will suggest we can give a small meals like hot soups, or a healthy diet
Yes,
like
ma'am,
vegetables.
it is
Yeah.
there. You
Yeah.
can do whatever you.
Yes.
I'm just saying that why I'm giving you the reason why the patient is
Okay.
not eating. Okay,
Yes.
to
Yes, sir.
maintain that, you can do whatever you want. Like you
Yes.
can take the help of a dietitian, or in fact, if you are good enough, then you can ask the patient to go for smaller meals, go for like multiple things, go for some flavors which they more like, and try to give them a balanced diet. But these are the reasons why the patient is actually not eating,
Yeah.
why the patient
Got
is having nutritional disorders.
right.
Coming to the psychosocial factors, depression is the most common factor which leads to lack of interest in eating, or anorexia, or food intake. And living alone will also lead to a lack of incentive to cook and eat. Okay, so this happens with everyone. This is not only applicable to elderly, but this is actually applicable to everyone. That when you are depressed, when you are not feeling good, when you are not having a very good day, you will not feel hungry at that time. Okay, now this is because of the depressive situation in which you are at that particular time. So you're not feeling hungry. Okay, living alone, or just to live by yourself, sometimes does not give an incentive to cook and eat. So this happens with the young people also, and elderly. So it will be like very problematic with them, because usually with the ladies or with the males also, what happens that once one of the partner is dead, the other one will automatically be like uh, uh, traumatized about it. It will be there, but the other one will be affected more onto the food intake. If the lady is dead, because the male was dependent onto that lady for food for so many years, now whenever he or she will be sitting for the for eating, they will get reminded of her. Okay, he will get reminded of her, and he won't be able to have that much food what he used to take earlier. When she was there, she was preparing a meal for him. He was finding it more, he might be finding it more tasty as compared to what he or she is getting right now. Okay, and if we'll take this condition in the vice versa condition, the male is dead and the female is now living alone. So now they'll think, now for whom should I cook? I've been cooking for this person since last 25, 30 years. Now he's not there. Now why should I cook more? I used to cook for him because he was very fond of food. He was a foodie. So I used to learn more and more things for him. Now he's not there. Why should I cook? So these kind of things will come to their mind and will actually cause decreased interest in the fooding habits. Okay. So this is actually applicable to everyone. And the best way to control this is through your control of your social factors, and one is through the food only, because sometimes what we call a food as soul food. Okay, a soul food or a go-to food. So everyone will have their soul food or a go-to food. Okay, which will give you a sense of satisfaction, which will give you a sense of happiness whenever you eat it, whenever you will eat. Okay, because you might have some memory associated with it, or it's just the taste which will release some of the hormones into your brain, which will actually elevate your mood. And it will happen with you if you are in a depressed mood and you get a good food, or you get something to eat very good, your mood will elevate. Just a not only food, just a small beverage. Like some people are very fond of tea, and if they are having a tough day and they get a good tea in their schedule, somehow their mood gets elevated and the day starts turning out in a different way. So is that clear to everyone? I hope everyone has some soul food in their itinerary or in their
Y-
life,
Yes, sir.
like a
Obviously.
go-to food. Go-to
Yes.
food. Like some people have that khichdi, or some people have that rajma chawal or dal chawal. I'm talking about the North India. I don't know about the South India, but some people have idlis. I have eaten very good idlis in Bangalore side. So I have seen people like they go for that kind of food, which is like more for their soul, not for their stomach. Okay, so if you give a person food which is for their soul, you can get the best out of them very easily. Coming to the economic and the cultural factors, the low income, limited access to food choices, and inadequate facility to food storage and preparation is one of the reasons why the patient is not able to have that proper nutrition support. And the cultural factors like eating habits may miss certain food groups as vegetarians. Okay, as vegetarians, we are actually subjected to less amount of nutrition sometime, because we are actually restricted with certain things. Like vegetarians are actually having a low amount of vitamin D and vitamin B12 levels in their body. Why? Because these are more frequent or present in more abundance in the non-veg food. But we are not in vegetarians, or in the Indian culture, people who are true vegetarians or pure vegetarians, sometimes these problems can occur, and because of this, the nutritional status of the patient can be dipped. Okay. So the importance, it has been estimated that 10 to 25% of the elderly people suffer from poor nutrition. Poor nutrition can contribute to heart disease, cancer, diabetes, depression, anemia, frailty, obesity, osteoporosis, and isolation. The barriers to good nutrition is disability, swallowing problem, poor vision, changes in appetite, nausea, financial problems, medication side effects, depression and anxiety, social isolation, dental problems, difficulty in shopping, difficulty in cooking, transportation problems, and other medical conditions. All these are the barriers to the nutrition. I have discussed this in the earlier slides. Overcoming to the nutrition, how can we overcoming the barriers to the nutrition? Chewing problem. If the patient is not having proper dentures, or having problems with the teeth, or having problem with swallowing, what we can do is we can give the patient juices, canned fruits, creamed or mashed vegetables, eggs, cooked cereals, which will actually give them more nutrition and will uh, remove the problem of chewing. Difficulty in the shopping, look for the grocery areas where you can have grocery delivery or shopping services. You can always ask the friends, family, or the social members for the help. Nowadays, this is actually solved very easily through the apps what we usually have in our phones, and you can get the groceries delivered to your home in within 10 minutes or 2 hours, whatever kind of app you are using. Difficulty in cooking, try microwavable group dining programs, or you can hire a housemaid or a house help for the cooking of the food. Poor appetite, eat with others. Ask the doctor if the medicine side effect could be causing the problem. Try different spices. If the patient is having a poor appetite, try to eat with others. It happens. You will observe this in your daily life also. When you are sitting alone and having the meal, you will have less food. And if you are sitting with 10 of your friends, you will have more food. Okay. So eating with others will actually relieve of your poor appetite, and your appetite will be more when you try to eat with others. Sometimes if the appetite is not getting up, you can ask the doctors, your treating doctor, about the side effects of the medicine which can cause the problem. Try using different spices. okay, which can change the taste of your palate, and you will have an increased appetite. Financial problems: use coupons, share with someone, try low cost options such as beans, soups, whole grain seals, look into the food bank program and other community assistance. Like we have in India, we have bhandaras, we have group kitchens in gurudwaras and everywhere else. And if there is another financial problem, the government is there to give you ration and everything. So you can opt for all these things so that the financial concerns are actually curtailed off. For expert help, talk to doctor about the referral to a registered dietitian. Okay, you can always get referred to a registered diet. So nutrition requirement, calories. The calorie requirement is diminished by 10% by the age of 51 to 75 years and by 20 to 25% in the age more than 75 years. The protein intake should be 0.8 gram per kg body weight, and a balanced diet of healthy elderly should contain around 12 to 14% of protein of the total calorie intake. During the infection, stress, trauma, the protein intake should be increased to 1 to 1.6 or 1.5 gram per kg body weight. If the patient is having any kind of infection, stress, or trauma, the protein intake has to be increased. Fat requirement: the fat should be either saturated or unsaturated. The fat intake limited to 30% or less of the total intake. Saturated fatty acids limited to 10 to 15% of the total energy intake. Daily cholesterol intake limited to 300 mg per day or less. The carbohydrates, which is the essential part for maintaining the normal blood glucose level, 50% of your total calories should come from carbohydrates. Simple carbohydrates such as sugar and honey should be avoided. Complex carbohydrates such as vegetables, grains, and fruits should be taken in abundance. Carbohydrates which have vitamins, minerals, and fibers should be taken more in the concentration. More concentration should be taken in your diet, as it will help in your bowel elimination and decrease the blood cholesterol level. Is that clear to everyone?
Yes, sir.
The fluid intake uh, should be optimal for everyone because of dehydration. So um, in the patient should they can have a decreased thirst sensation, inadequate fluid intake or less than 2000 to 3000 cc per day is an inadequate fluid intake. Some medications such as high BP or antidepressants or diuretic require more of the water intake. So the patient should be subjected to more of the water intake. Some medications may cause patient to sweat more. Frail seniors have harder time getting up to drink when they are thirsty. As we age, the body lose kidney function and are able to conserve less fluid. This is progressive from the age of 50 years and become more acute and noticeable over the age of 70. Illness, especially the one in which the vomiting or diarrhea is occurring, can cause an elderly dehydration, and at that point the patient should be subjected to more of the fluid along with the minerals and the salts which is required for them. I hope this is clear to everyone.
Yes, sir.
Vitamins and mineral requirement: calcium and vitamin D are one of the most important. I have forgotten to mention sodium and potassium here also, because they are also actually very much required in the system. And if the patient is having a lower amount of sodium or potassium, generally seen in the patients with diarrhea, a severe diarrhea or a severe dehydration or vomiting episodes, the or in fact with the increasing age, the patient can have a condition of hypo or hyperkalemia or hypo or hypernatremia, which is actually associated with this more and less condition, less amount of sodium or potassium into your body, which will cause a problem in the osmolarity of the blood, which will cause delirium and cause problems with the muscle activation or the muscle contractions, and can cause problems with the heart failures as well. Okay. Similarly, for calcium, the mineralization of the bone, calcium is required and has a role in the blood and the cardiac function. The daily requirement is 1200 mg per day if there is no contraindication. Okay, so if the patient is not having much of the osteoporosis and the patient is not having any other kind of contraindication for the calcium, the patient should be given 1200 mg per day for the calcium in their daily dosage. Vitamin D, the need for calcium, it is needed for calcium absorption and metabolism, and exposure to 15 minutes per day to the sun is enough for getting the normal dose of vitamin D into their normal daily routine. Coming to the rest and sleep, a person spends 1/3 of his life into the sleep. The sleep is a time for the cell growth and repair, and elderly needs 5 to 7 hours of sleep at night. So whenever we are actually trying to recover more, you will see in the normal people also that they tend to sleep more because they are trying to recover. If you will see, I'll always compare an elderly to a child. So if you'll see or if you'll observe a child, he or she actually spends most of his time sleeping. Why are they sleeping for this longer period of time? Because the body is regenerating at that time. Our body is actually having that growth period at that time. The better a child will be sleeping, the better he or she will be growing, or better growth they will be having. Similar thing happens with the elderlies also. The better sleep an elderly will be having, the better growth or the better regeneration they will be having, a better recovery they'll be having, and they'll feel much fresh as compared to a person who is not having an appropriate sleep at night. So importance of the rest is to conserve the energy, provide organ respite, which is the rest, restore the mental alertness and the neurological efficiency, relieves tension, and emerge feeling of well-being. All these things are coming from rest. That's why rest and sleep is very important, and you should promote your patients to have a good night's sleep. Or in fact, if they are not having a good night's sleep, ask them to have multiple bouts of sleep, sleep for sometimes in the day, sometimes in the evening, so that they can make out for the total period of rest which is required for them. Why is the older people finding it difficult to sleep? At night, our body makes hormone that prompts the sleep called melatonin. The older people make less of it, so they find it difficult to get off to the sleep. The other factors which may interfere with the sleep and cause wakening during the night is the hot flushes in the postmenopausal women, and sometimes they need to go to the toilet, and other medical problems such as arthritis or any other pain, which makes it very difficult for them to stay in one position for the night, and they keep switching their positions. In addition, after the retirement, many people find it convenient to take a short nap during the day, because of which their biological clock gets disrupted and they are not able to sleep for longer period in the evenings or in the night. So what needs to be done? Their biological clock needs to be reset again. They have to be given a new schedule so that they can arrange for all these things and sleep a better cycle. Factors affecting this sleeping pattern: age-related factors, internal factors, and the external factors. Coming to the internal factors, many diseases can make it hard to sleep. Some of them are like arthritis, osteoporosis, Parkinson's, incontinence, indigestion, heart disease, lung disease such as asthma or COPD. Drugs used to treat some conditions may also interfere with the sleep. Some sleep disorders are more common in old people, including the sleep apnea and periodic limb movement disorder, which is PLMBD. Okay, PLMD, which is periodic limb movement disorders, in which the patient is having actually twitching kind of action onto their one limb for multiple times. So it will give them a sensation of shock, and the patient won't be able to sleep for a longer period of time. So these all are factors which are actually present inside the body of the patient or the subject, will hamper the sleep. Coming to the sleep disorders and aging, the sleep disorders which increase with the age are sleep apnea and periodic limb movement in sleep. The periodic limb movement disorder is also called nocturnal myoclonus. The sleep apnea is an interruption of the breathing during sleep. It is common by obstruction or blockage of the airway. Rarely, sleep apnea is caused by a problem of the nervous system which controls breathing. Sleep apnea is very common among older, overweight people. So, if you have a patient or a subject who is older and is overweight, then the chances of them developing sleep apnea is quite high. I'll just give you an example of very famous celebrity. Can anyone of you remember him? He died of sleep apnea. Very renowned. Do any one of you remember him? Am I audible to everyone?
Yes, sir.
So, any one of you remember who that celebrity was?
No idea, sir.
So is it Bappi Lahiri?
Yes, yes, Bappi Lahiri sir. So, everyone of you remember Bappi Lahiri sir's face. So, he was not thin at all. Okay. And he actually died of sleep apnea because he was having this problem for a quite long period. And once one fine day when he was sleeping, he had this episode of sleep apnea and he was not able to breathe properly and caused him his life, and he was found dead in the morning. So this is the like a major problem in the elderlies which can happen because of patient being overweight. How can you go for self-care at home? Maintain a regular wake-up time, maintain a regular go-to time to sleep, avoid or decrease daytime naps, exercise daily but not immediately before bedtime, use the bed only for sleeping or sex, please. This is very important. You do not use the bed for other purposes. Like in India, we have a tendency to use the bed as a dining table, as a study table, as a playground. See, everything has a vibe attached. Okay. So if you will change the vibe of that particular uh, place, you won't get that similar vibe which you require for that particular activity. Okay. So the bed is meant for sleeping. Keep the vibe of that bed for sleeping only. If you are taking it for study purpose or food purpose, you are changing the vibe. Or if you are not aligning with this vibe term, you are actually cluttering the area with the kind of stuff you need for that particular activity, what you are doing on the bed. So if you are eating on the bed, you might be having sheets which have to be placed for before eating the food, or maybe the vessels are there in the on the bed, so you will not be able to lie down properly. If you are using the bed for the study, then the books will be there, your laptop will be there, your phones and other study materials will be there, so you will not be getting the proper area to sleep. Okay, so you have to use the bed only for sleeping. Or six, don't read or watch television in bed or use the phones in bed. We always say that at least avoid your body for any kind of blue radiations at least 1 hour before the bed, or a minimum of 20 minutes should be the break between your last use of the phone or television and your sleeping cycle. Don't use bedtime as a worry time. Please do not lie down in the bed and worry, because once you start worrying, the thoughts will start popping in your mind and the brain will start working again and you will lose the sleep. Avoid heavy meals at bedtime. Try to keep meals as light as possible during the bedtime. But in Indian scenarios, we usually have a different meal. Okay, we usually have the heaviest meal in the night. Do you agree? Everyone, do you agree with this? We have in India, we have the heaviest meal in the night.
Yeah, most of them around 80 to 90% will have, sir.
We have all the parties and all the things happening at night, and we always have the fried food and everything at night. So this is not advisable for elderlies at least. Avoid or limit alcohol, caffeine, and nicotine before the best bedtime. Maintain a routine period of preparation of bed, for example, washing up or brushing teeth. Control the nighttime environment and comfortable temperature, quietness, and dark. Wear comfortable, loose fitting clothes to bed. If unable to sleep within the 30 minutes, get out of bed, perform a soothing activities such as listening to soft music, reading, but avoid exposure to bright light during these times, and get adequate exposure to bright light during the day. All these things are actually helpful in getting a better sleep at night. Okay. Coming to the periodic medical examination, always subject the elderly for a periodic medical examination. And the importance of the periodic medical examination is to assess the elderly's level of well-being, detect early signs of the disease, educate the client how to promote his or her health, reinforce positive promoting and protecting behaviors. If the examination is done at home, it permits the evaluation of the environment. Okay, so you can always assess the environment in which the patient is actually dwelling, and you can change the environment of that particular region also, so that the amount of hazards that a person is subjected to will get reduced. Okay, in this, one thing I want to add more is, you can ask the patient to go for immunization regularly. They should be in touch with their doctors, and they should go for immunizations like shingles and pneumococcal vaccines and other diseases which are actually prevalent at that particular time, like flu and shingles. They are very common nowadays, so the doctors suggest them to go for all these vaccines at least once in 6 months or once in a year. And similarly, we always say that patient to go for a ATS vaccination at least once in 6 months. Okay. Coming to the high risk behavior, it is the behavior that damages the physical health. If the patient is having any kind of behavior or any kind of what you can say, habits which can cause a serious damage to the physical health, we consider it as high risk behavior. So if the patient is more dependent on over the counter medications or multiple medications, as we discussed in the first class, if you remember, we discussed about polypharmacy. Remember, one of you also discussed about one of the patient that you are having, and that patient was subjected to polypharmacy, how to manage it. So we need to make sure, we need to understand why the patient is having this over the counter medication urgency, or having multiple medications which can lead to polypharmacy and can cause a high risk behavior. Smoking and excessive caffeine intake is actually also very problematic for the patients for getting this proper health and proper sleep. Coming to the safety measures, one of the basic needs of the elderly. So for elderlies, whenever we are subjecting them to stay at one place, or we are subjecting them to go for exercise or anything, being at home or being in the outside world, they have to be subjected to certain kind of safety measures. They need to be kept safe, just like a child. When we are talking about a child, we are keeping them safe from sharp objects, from heights, or from anything which can cause a disruption to their health. Same way, we need to take care of our elderlies. We need to be sure that all the things around them is safe for them. An old adult who has a mental, sensory, or a physical loss like poor balance or weak muscles is a safety risk. These losses and the aging process make the adults prone to accident. An old person has a poor vision and hearing, is confused, and has a judgment that can lead to slip, fall, getting hit by a car, drink of a chemical, cut the hand by saw or blade, overuse of medicine. All these things can lead to a serious medical issue. Safety is a major concern when working or providing care to the older adults. So when you are actually taking care of older adults, whether you are taking care of them in their home setting or at your clinic, so you need to be very sure, and you need to be very particular about the safety purposes. For example, if you are applying any kind of electrotherapy to the patient, okay, I'm just saying the normal electrotherapy, TENS or IFT, this can also cause a burn into the patient, because if the patient is not having a proper sensation, Okay, the patient is not having a proper sensation. The patient is having a altered sensation in the hands or the leg region, and you applied the TENS or any kind of electrotherapeutic modality, and you ask the patient whether he or she is getting a proper current or not, and he or she said that no, I'm not getting, and you increase the intensity to such a level that the patient got burned in that particular case, can be a medical legal issue, and it can backfire onto you. Okay, so what you need to do is you need to make sure that all the safety precautions are taken while treating or taking care of the older adults. Is that clear to everyone?
Yes, sir.
Yes, sir.
Fall, burn, poisoning, accidents are the most common problems in the adults. General safety measures both at home and away from home are encouraged and recommended to elderly patients and their family members. Fall and injury, confusion, adherence to medical instruction, and future health and financial planning are among the concerns pertinent to the elderly care. So all these problems like fall and injuries, confusion, adherence to the medical instructions, future health and financial plannings, these are the concerns which are actually more prevalent in the society now, especially when we talk about the elderly care, and has to be catered properly. Coming to the journals, home safety, what you can do at home for the patient, consider a medical alert. Okay, you can always put up cameras like we do. Again, I'm comparing the elder with a child. Okay, it's better for you, it will be easier for you to compare the elder to a child, because whatever you are trying to do with a child, just do the similar thing with an adult, and you will reduce or remove 50% of the conditions or the problems which the patient is actually facing. So consider a medical alert. Always, like, if a person is living alone and the children are living somewhere out, or they are not at home at that particular time, what they can do, they can install certain cameras which have motion sensor, or which have some fault detections. Nowadays more AI things are actually coming up, so you can always apply for that. You can give them a phone or a smart wearable which have a fault detection alarm, which will indicate that the patient has fallen, and they can it will just send a message or a alert to the person who is in charge or who is actually looking forward for the care of that particular patient. In fact, we have special phones for the elderlies which have a dedicated SOS button, so they don't have to call, because sometimes what will happen, they will not remember the calls of the numbers of their near and dear ones or their caretaker, so they can just press that one button, and a message will be sent out to the persons who are actually taking care of that person. So it will become a medical alert. Keep a fire extinguisher and a smoke detector on the every floors. Use extreme caution while smoking. Never smoke when alone or in bed. You need to make sure that patient never smokes when he or she is alone or when he or she is there in the bed, because it's a fire hazard. Always get up slowly and after sitting or lying down. Take your time and make sure that you have your balance. Make sure you always teach your patient that do not get up as soon as you open your eyes. Okay, take your time, take some time, get into the vibe of the day. You ask them to do it, and do it in a slower manner, so that they don't go for an orthostatic hypotension or they lose the balance. They should first assess their body. Once they are sure that their body is functioning normally, then only they should get up. Wear proper fitting shoes with low heels, no high heels for the elderlies. Use correctly marked walking aids. Remove or tack down all scattered rugs. Okay, so the rugs are actually one of the biggest problem for the patients for tripping and falling down. Remove electrical and telephone cord from the traffic areas. So please, if there are any uh, open lying wires in the house, for the chargers or the mobile phone or the internet, make sure they are neatly tucked inside or held in place with the proper holders or tapes, so that no one can trip and fall from these wires. Avoid using slippery wax on the floor. Wipe up spills promptly. Never keep the floors wet or slippery. Avoid standing on ladders or chairs, because the elderly will have this tendency. They'll try to fix something and they won't get that like what we say that uh, they won't call for any kind of help, or they won't try to take that stairs, like uh, that's not stair, ladder is the specific word. They will not take ladder to fix something which is there on to some height, because they might not have that strength and they might not know where this ladder has been kept. So what they'll do, they'll pile up 2 3 uh, pieces of furniture, a bench or table, and they'll make a tower of out of it, and they'll try to climb onto it and try to fix that thing. Now these things are actually not very stable and will actually lead to disbalance and fall. So is that clear? General home safety. Coming to the bathroom safety, leave the light on in the bathroom at night. Please do not switch off the lights in the bathroom at night. Use recommended bath heats securely installed on the wall of the bath or shower stall or on the side of the toilet. So sometimes you might have seen some rails are being put onto the public toilet areas just to aid the elderlies for this thing. So they can be installed in the household settings also, so that the patient is having no problem in getting up or getting down to the toilet or the bath areas for doing their regular work. Make sure the bathtub has non-slippery bottom. If you have installed bathtubs or you have a separate shower area, so make sure that the shower area is non-slippery. And if it is slippery, so please try to install a non-slippery coating onto that. Avoid scald. To avoid scalds, turn the water to 120°F or below. So always try to keep the water temperature to the level where the patient is feeling comfortable, not burned. Okay. And because they sometimes they don't have that sensation, so it's better to keep the water temperature below 120°F to make sure that patient does not have any kind of scalds. Use the door locks that can be opened from both sides, and if possible, bathe only when the help is available. Okay, so if please ask the patient to have a bath only when the help is available. Sometimes what happens, the patient goes in for a bath and no one is available for the help, and some mishap occurs. The patient will be stuck in the bathroom for a longer period of time and will be subjected to a lot of problems. Okay. Coming to the kitchen safety, keep the floors clean, mark on and off position on the appliances clearly with bright colors, especially onto the gas units, the gas stove, because the fire is one of the biggest hazards which elderly usually have, because they forget to turn off the knobs or they will not turn off the knobs completely. Okay, so you need to mark the on and off positions very clearly. Store the sharp knives in a rack, because what happens sometimes, if there are sharp knives and it is on some very high area, and because of some mishap it gets fallen onto the elderly, they can get themselves hurt very easily. So if it's kept in a rack and the rack is actually closed, so it won't fall onto the subject and won't hurt them. Use a kettle with an automatic shut valve. Store heavier objects at the waist level. This actually we say to everyone, because if you store the heavier object at the waist level, you won't have to put up lot of effort for either getting it down from a higher area or trying to lift it up from a lower area. Okay. Store hazardous items separate from the food, so that it cannot get mixed or it cannot be misidentified as a food item. Avoid wearing long, loose clothing while cooking over the stove, and make sure the food is regulated. It is rotated regularly, and you always check them for the expiration date. Always go for the food which is not expired. And if there are the things which are expired, so you need to remove them from your system. Drug safety, review your medicines frequently with your doctors, and when you take new medications, make sure medicines are clearly labeled. Read the medicine label in good light to ensure that you have the right medicine, and always take the correct dose. I have seen some patients, they have been subjected to taking the medicine twice a day. Okay, but because they were elderly, they thought that because if I am taking the medicine twice a day and I'm getting better in 30 days, I'll take the medicine 3 times a day and I'll get better in 20 days only. I'll reduce the time. But this can be harmful for them. So always ask them to take the correct dosage, dispose of any old or unused medicine, never borrow the prescription drugs from others. Because if the other one, if a one person is having diabetes and that person actually forgets his or her medicine, and the other person is having also diabetes and he or she is having an oral hypoglycemic, there might be a chance of having different dosage amount. He or she might be on a higher dosage, or the patient who is asking for the drug might be on a lower or a higher dosage, which may not be sufficient for that particular person and can lead to a complication. And check for your doctor or the pharmacist before you mix alcohol with your drugs. So please ask your patients not to mix your drugs with the alcohol, because it usually have very negative effects onto the patient, especially if the patient is on any kind of medication for depression or psychological conditions like insomnia or something like that. Okay, so please make sure that the patient does not take alcohol with them. So thank you. This was it for the session today. If you have any kind of queries, you can actually discuss with me now.